Rhode Island has. And so they're a little over 3% with respect to testing. And New York is, obviously bigger than us. They had a hot spot much earlier than we did, much bigger and more pronounced, and they've tested just more than 3% in New York. So what we're trying to do is to make sure that we're doing as much as we can do given logistics. I'd love to tell you that we'd like to put a mark on the wall and test 10% of the population in Georgia, but that's not realistic. We're going to test what we can source for.
Governor Kemp, if you could, for the sake of summary and clarification, exactly which businesses will be allowed to reopen on Friday, which ones will be allowed to reopen on Monday, and I know under several restrictions, and then what's the plan for everyone else after that and the timetable? So on the last question first, the rest of the timeline for ramping back up, entertainment venues, concerts, we're just going to continue to follow the data. I don't have a target for that right now. The businesses that are really that's opening up Monday is the dine-in restaurants. So that's really a week from today. This Friday, you're talking about barber shops, hair salons, those businesses that had that personal contact, massage, therapy places, the elective surgeries we mentioned, some of the schools for these individuals. I think I mentioned artist parlors, tattoo parlors, places that Dr. Toomey had advised me when we were in the throes of this that just that contact is not a good thing to be doing. But now that we have the medical facilities stood up, that we have the contact tracing piece stood up, that we're doing a lot better job on testing than we'll be in the days ahead. People can go back to these activities as long as they're following the guidelines that we have, which, is that list of 20 things. Cleaning. I mean, obviously, if somebody's giving a haircut, it's probably a good idea for them to be wearing a mask and do extra cleaning on that chair after the customer leaves. Not packing the waiting room at a barber shop or a salon, but do appointment only. Call people when they're sitting in the car, and when the chair opens up, let the next person come in. I mean, Georgians that are small business owners, those people have good common sense, and we're trusting them to use it. But if they abuse it, we will take further action. But I believe that they can do that as part of this measured approach.
And Governor, just as a follow-up, I know you're basing your decisions on medical science and data and the best advice you can get medically and economically, but if you could share with us your thought process and how this is weighing on you. This could be one of the most important decisions you will ever make in your personal or political life, because so much depends on getting it right. Opening, reopening too soon, you can imagine the potential consequences of that. What goes through your mind when you think of that?
Well, I can tell you I don't give a damn about politics right now. We're talking about somebody that has put their whole life into building a business that has people that they love and work with every single day, working in many of these places, that are at home going broke, worried about whether they can feed their children, make the mortgage payment. These are tough decisions, no doubt, and I've had to make many of them, and I can promise you I will have to make more of them. But we also got to think about the effects on our economy and on these individuals from a mental health perspective, from a physical health perspective, and literally for people being able to put food on their tables. And I believe that this measured approach has got us to the time to trust our people, to keep going after and beating this virus, but do it in a way that is responsible. And I believe the people that own these businesses, as well as the people that work in them, are okay doing that for a few more weeks till we can move into phase 2. And it may be that they can't all go back to work every day. But you may be able to go every other day and split the workforce up in those businesses just to get the doors open, to get some money flowing, and to get those people where they can feed their family. But look, I understand the health care ramifications as well. I've been getting the calls from people saying we need PPE. We don't have a bed for a hospital patient. That is why we've been working literally for over a month, standing up these additional facilities. Literally, Homer and General Carden have been, across the world trying to find supplies and equipment, healthcare workers to help us in this time of need. And we have battled a lot, but it is amazing what this team has done under just nothing that nobody's ever seen here. We have every state and territory in the United States of America that's under this emergency declaration, the first time it's ever happened. You don't have 2 or 3 states that got hit by a tornado and need GEMA help. You have 50 states. So this is unprecedented. So yes, these things weigh on you. But all I can do is work hard every single day, listen to the good advice that I'm getting, and make the best educated decision that I can going forward. And I believe that I've done that today.
Governor, I have a question about enforcing these restrictions. State law enforcement officers have only issued about 24 or so citations over the first 2 weeks of your shelter-in-place order. How do you ensure that businesses follow these new guidelines and that law enforcement have the resources to make sure they comply?
Well, as I said earlier, we're going to be putting out additional guidelines through the week, so we'll continue to talk and answer all of these questions, working with the industry folks. That's why we gave ourselves a few days before all this goes into effect, so we can be methodical, we can get people educated. Our goal with law enforcement was never to go around and arrest a bunch of Georgians for not following the order. I think our citizens, for the most part, understand how important it was to do this and did it voluntarily. Those that did not or didn't know, then we have helped educate them. For those that, after they were educated, wanted to be obstructionist, then we started writing tickets and started discussing other measures in conjunction with local law enforcement and state officials. But I would tell you, we get reports throughout the day, many calls. We have 2 conference calls a day with over 24 people on them giving reports about where we are. And many of those calls have been law enforcement related, DNR, monitoring state parks and beaches, and most of the people that we have had to talk to have been very understanding and do exactly as we say. And that's what we're asking Georgians to do. But if they do not, we'll take steps if required. But they also need to understand that if they don't follow this guidance and adhere to it, they could be putting the lives of their customers and their family and their neighbors at risk.
Governor, you talked about the financial hardship for many Georgians during this time. Many states have adopted a moratorium on evictions and foreclosures. Is that something you have considered or will consider?
Well, we're considering anything that we're getting suggested. As you can imagine, I'm getting a lot of advice and a lot of suggestions, which I appreciate. It helps me keep close to the battle at hand. We haven't had in-depth discussions about that. I have had a few people that have raised that issue, and we'll certainly continue to consider that, but I haven't taken any action so far.
I just had one follow-up on the testing capacity. The general mentioned that they're going to do everything they can. Everything's working except at the back end in terms of the supplies and the kits. How do you overcome that when that's a problem, not just here, but nationally?
Well, we had a lot of good information on the call today with the Vice President. They talked about the supply chains for swabs and many other things. So I felt very good about what he told us today, the reports that we got from a lot of the individuals that are involved in that. And so I think the supplies are going to continue to loosen up from a nationwide perspective. Also, I think as you have hot spots like New York and California and Washington that start coming, New Orleans and others that are coming off of the peak, it'll continue to open up supplies of certain things. Look, the industry knows that we got to test. So I'm sure that people are working 24/7 on that, and we'll continue to do that. What I had charged General Cardin to do is to take every test we got and use it every single day. And when we run out, then we'll figure out how to get more tests. I believe that if we run out, it'll be easier for us to get tests. So that is our first goal. The second goal is we're trying to take where we can, our destiny in our own hands. And that is why Augusta University, the dental school, being able to 3D print these swabs is so powerful for us. And I believe more swabs are coming. The Vice President talked about that today. Literally, over 1 million that they, I think, are going to have delivered this week, another 800,000 next week, and I can't remember all the other numbers he said. But that made me feel good when I heard that today. But bottom line is, we're going to do some of that right here in Georgia and control our own destiny.
Governor Kemp, can we talk a little bit about the prisons during the lottery? I know we talked about that a couple of weeks ago, but given some of the changes that are coming up this week, can you address those populations in terms of testing and what's happening with, again, prisons, nursing homes, and the lottery?
Well, I can let General Cardin speak more to nursing homes and prisons with testing. So I think it might be good for you to hear him on that. What was the specific question about the lottery?
There are some folks asking about, is that going to be, what's changing in terms of that? We've had viewers call in about the Georgia lottery, and I know that was something that you said you were looking into last week. We spoke to.
Yeah, I still haven't considered changing anything from our current practices right at the moment. General Cardin.
So let me first address what we're doing in prisons and in Department of Juvenile Justice and in mental health facilities across the state. The infection control teams that we put together initially for nursing homes demonstrated a whole lot of utility in our behavioral health facilities. We also trained members of the Department of Corrections in our tactics, techniques, and procedures, as well as juvenile justice. And so they, on their own now, have been trained, and they're able to deploy those techniques to prevent people from getting COVID-19 to start with. As we deploy these strike teams, obviously where we've seen our enemy generate what we call mass in my business is in nursing homes and in all of our long-term care facilities. So that's the focus. And then at the direction of Director Bryson, we're bringing the law enforcement and first responder critical infrastructure workers into that fold. And as the Department of Corrections generates a demand signal back to the director and back to public health, then as we have limited capacity, as the governor's already laid out for you, then we have to focus that capacity on where our public health officials think it's most effective first. And as more capacity comes online, we're certainly going to deploy that in those areas where obviously people are together closely in many environments, mess halls, chow halls, that sort of thing. And so we're focusing on all that. But let me just tell you, with respect to our nursing homes, I've seen a lot of reports on what is and is not happening in nursing homes across the country. But I can tell you what's happening in Georgia. And I would challenge you to find a state or a territory that's got more than 1,300 service members deployed to make those living in those long-term care facilities more safe. We get calls every single day from other states and other entities wanting to know what we're doing in Georgia in these long-term care facilities, and we've shared this just in the last few days with Alabama, Missouri, Montana, and Iowa, just to name a few. So I'm very, very proud of what our teams are doing out there in our long-term care facilities. We're going to continue to do all we can in the behavioral health community and in corrections and Department of Juvenile Justice to help our teammates on our left and right to be successful in this fight.
And while we're there, real quick follow-up with the Augusta AU partnership. Is this new centers that you're going to be opening up, or these are the existing ones with DP8 that are already set around the state in terms of more testing for those folks with the app?
I'm glad you asked that question. Augusta University, the governor mentioned it several days ago with respect to their app and their process. And what we did, Dr. Toomey and I went over and took a look at it. And Dr. Toomey determined that it was scalable. And so when you take something that works and you scale it very rapidly, then you can quickly put yourself in a position to achieve what your boss wants you to do. The governor said to increase testing, and we saw that as essentially a fast-moving horse that we could put a saddle on really quick. And we believe it's gonna work. And I will tell you, Augusta University, great teammates. But it's not limited to just Augusta University. The university system of Georgia has been nothing but supportive, and they're driving this initiative. Our private partners are driving this initiative. Again, this is not an I and me mission. This is a us and we mission.
Thank you.
Please.
Yeah.
I wanted to say thank you that we are looking at the existing sites, but also recognize there are parts of Georgia that don't have testing sites, and so we're not limited to just the sites. Where's General Cardin? Just those sites, but we are actually trying to actively identify additional areas that do need additional sites to be stood up, and we'll also add those as well.
Governor Kemp, Tariq Wynn with Tariq on the Move. My question to you is, based on the way things have gone so far in our state in regards to the coronavirus, what grade would you give yourself as far as showing leadership and handling the situation?
Well, I think the press has been doing a pretty good job about following what we're doing. I'm not in the business of grading myself. I can just tell you I'm working hard every day to fight this virus and to do what I can to keep our people safe.
Governor Kemp, how much have you coordinated these actions with other states? Come Monday, if you live in Augusta or Columbus or Ringgold or St. Mary's, how similar are the rules going to be on the other side of the state line?
Yeah, I wouldn't want to speak to what other governors are doing. You know, we did have the call Saturday. We felt like that would be a good idea. It was a great call. A lot of great governors on there that I know very well, have great relationships with them. They're very honest and, pragmatic people. I mean, everybody's dealing with different issues in their state, right? It depends on, the size of their state and what Tate Reeves in Mississippi's dealing with versus what we are in Georgia. In many ways is a lot different. But we did just talk about the president's plan, how that applied to our states, where people were in the process. And I think you'll start seeing other states, they may have already done this, start taking some actions here, today or in the next few days. I don't know specific what they're going to say. If I did, I wouldn't tell you anyway, because I feel like it's up to the governors to finalize their plans and roll it out. But I think for the most part, they feel like we're moving in the right direction down here, and I think everybody's thankful that we haven't been dealing with a lot of big hot spots. We've certainly had the Albany situation that has consumed a lot of our resources and time, but it's a lot different than New York or New Jersey or Chicago. So, I think you'll see the governors continue to take measured steps. And, they understand the plan that the president put out there. They're on all these calls like I am, and we understand the guidance. And look, I'm appreciative of the president's plan and the thought that went into it, the vice president and the task force and what Dr. Birx and Dr. Fauci have laid out. It gives us, a good path to follow, and that's exactly what we're doing with this measured approach.
Governor Kemp, thank you again for your time today. With your decision today to begin reopening the state, are you still holding steadfast in your decision to keep schools closed, or would you maybe reconsider that?
You talking about for the remainder of this year?
Yes.
Yes, absolutely. That is a decision that I had in conjunction with a lot of educational leaders. They kept telling me, look, if we get past a certain point, it is not going to be worth bringing us back. It's going to take too much to try to ramp back up, get everybody back in, reorganize, get the kids acclimated. They told me if it gets too far out, just go ahead and call it where we can continue to focus on distance learning and just own that and do the best we can. Don't pull the rug out from under us and let us continue to work on next year. So, no, I will not be going back on that decision.
Governor Kemp, do you anticipate contract tracing or monitoring through an app becoming a requirement for admission to future large-scale sporting events or concerts once those have reopened?
Well, I wouldn't want to speak to the specifics of that. I think I mentioned in my remarks that we're going to continue to follow the data to see about those type venues and events when we get to them and start moving into other phases. You know, how we deal with that, I think, will be something that we continue to do in conjunction with, you know, our healthcare officials and people that have the ability to do that. But look, I do think you're going to see the private sector start doing a lot of these innovative things, whether it's putting, you know, the infrared heat seeking or temperature, you know, gauges, you know, the detectors when you walk through a certain establishment to make sure that, you know, you're not letting someone enter that may have a fever, whether it's the workplace or a restaurant or, you know, movie theater, whatever the case may be. I think there's going to be a new norm until we get a vaccine or get a treatment for this. But I think our citizens understand that. But exactly how we go about doing that, I wouldn't want to try to speculate on that right now. I do think it's important for people, if they start getting the symptoms, then they should download the AU app and talk to a physician that can give them guidance on whether they need to be tested or not, and get instructions for how to handle this. I think that's a very powerful tool, and I know if I was in that boat, that's exactly what I would do.
Claire's going to be last one.
Oh. Governor Kemp, many of the businesses that you're allowing to reopen on Friday are put together with people who are independent contractors, and many of them have applied for unemployment benefits but have not been able to get them yet. What effect might reopening those industries have on their ability to get benefits, or perhaps even back benefits from the time that they were unable to work?
Well, that'd probably be a question to be better answered by our Labor Commissioner, Mark Butler. I know they've been working very hard over there. They're the ones that's getting the federal guidance on that. Look, we're trying to give them the opportunity to get back to work. You know, how they're dealing with unemployment and what's coming down the pipe, I wouldn't really want to try to speculate on that. I know a lot of the guidance, especially for the 1099 workers and the gig workers. I think I updated y'all press conference before last that I had spoken to the Vice President about getting Secretary Scalia to send that guidance. It's my understanding that that's been done, and those claims are now being processed. I believe that they would still be eligible for that. Obviously, if they go back to work, you know, that will change the period which they may be eligible, but I would refer you to Commissioner Butler.
Thank y'all. I'll be around.
All right, guys, that again was an update from Georgia, hearing from not only the governor but other officials there on their response to COVID-19. Here's a look here at the United States of America. As you can see, we do have more than 778,000 cases of coronavirus here across the United States. Obviously, there's a lot of heavy populated areas that have been hit harder, like New York, California, even the Seattle area, as many people have unfortunately lost their lives also from COVID-19 in many of those states and all of our states across the country. We do have 41,313 deaths here in the U.S., but above all else, it is important to mention we have more than 3.8 million people here in the U.S. who have been tested for COVID-19. And so that is one of the great things that you see. Even though our number is getting close to that 800,000 mark, we have tested more than 3.8 million Americans for COVID-19. A lot of them have been talking about symptoms that they have felt or haven't felt. That's why they got tested. We do have some of those stories and articles all available for you to go and check out on coronavirusnow.com. If you're with us on the YouTube side, just a heads up, we're going to be ending this stream and starting our new stream as President Donald Trump and his coronavirus task force team step out for the Monday briefing. And so once again, if you're with us on YouTube, we are going to be ending this stream and starting our new coronavirus task force stream here in just a few minutes. If you're with us on coronavirusnow.com, hang out with us for just a few minutes. We're going to give you more content as we wait for the president and his team in just a few minutes.